Hi, and welcome to SGK Dental Associates. We are happy to have you in our office today to discuss dental implants. At SGK, we know that replacing missing teeth is an investment that you want to be happy with. So we're here to guide and inform you about dental implants. Losing one or more of your teeth can create a gap in your smile, affect your ability to chew properly, alter your diet and nutrition, and it can even cause bone loss. Whether you lost a single tooth due to trauma or multiple teeth due to periodontal disease, dental implants provide a great treatment option to replace your missing teeth. One or more dental implants can be placed in order to replace the root or roots that you are missing. Once the implant has been placed, a dental crown, bridge, or possibly a denture can be attached to the implant or implants to replace your missing teeth. Dental implants are made of titanium. Titanium is a very safe metal that has been used in medicine and dentistry for years. Things like artificial joints and rods are made of titanium. Titanium is an inert metal. This means that in most people, it can be surgically placed into their body without being rejected. However, there is a small chance, between 3% and 8%, that it can be rejected. There are many options for whom your implant can be placed by. The implant can be placed by a general dentist or a specialist. An oral surgeon, periodontist, or prosthodontist are all specialists with extended years of training in implant placement. The crown that will replace the tooth will be restored by the dentist or the prosthodontist. When it comes to the fabrication of the actual crown that will replace the tooth, it can be fabricated with aesthetic tooth-colored material, metal, or a combination of the two. There are a variety of choices. It is important that you have a say in which type of restoration you prefer. However, the restoring dentist or prosthodontist will educate you on which materials might benefit you the most. In all instances of implant procedures, there can be no guarantees towards the outcome of the restoration. With this being said, it is imperative that you understand your case, and we will do our best to present the limitations of your case to you. There are some cases where additional surgery is necessary in order to be a candidate for dental implants. Often, this is due to bone recession in the jaw and bone loss in an area where there are missing teeth. After a tooth has been removed, the jawbone begins to recede or resorb, leaving an area of thin bone with less height. When this is the case, a procedure called bone grafting can often be performed in order to restore bone height and width in the area. Some bone grafting procedures are very simple and only require the addition of bone around the neck of the dental implant. Other procedures to restore the bone are more complex and require transplanting bone from one area of the jawbone to the needed area. The upper jaw presents a challenge not found in the lower jaw. Situated above the roots of the molars in the upper jaw is the maxillary sinus. The sinus is a hollow cavity in the skull. When excess bone recession has occurred in this area, a dental implant cannot be placed without a bone graft. The bone depth in this area can recede to a thickness of just a few millimeters. An implant placed in this area would protrude into the sinus. A specialized bone graft procedure can be performed called a sinus lift, which involves lifting the soft tissue of the sinus floor and bone grafting beneath it, creating adequate depth to accommodate a dental implant. Hygiene is a very important topic that must be addressed when considering dental implants. One common myth is that since the restoration on the implant is not a real tooth, you do not need to adhere to proper oral hygiene with it. If proper oral hygiene is not strictly adhered to, a condition known as peri-implantitis can occur. Peri-implantitis is complete bone loss surrounding the implant as a result of not properly cleaning in the implant area. Peri-implantitis can lead to the failure of your implant, but is preventable if proper oral hygiene is adhered to. Smoking is another area that is extremely detrimental to the success rate of a dental implant. Smoking causes microvasculature of the vessels, which ultimately decreases blood flow in specific areas of bone. When this occurs, there is insufficient blood supply in the bone surrounding the implant, and this can be extremely dangerous to the healing process. As a result, it is important to consider smoking cessation if you want long-term success with your implants. There are a variety of pricing options for your implants, and these can all vary depending on which dental professional provides your treatment. At the University of Oklahoma College of Dentistry, the implant prices are set at rates which are much lower than a large number of private practice dentists. As a result, this provides the opportunity for more people who originally thought implants were not an option to have the opportunity to make an implant a reality. The implant surgery at the College of Dentistry is $730. The implant crown, which is restored on the implant, costs $630. The implant abutment is $200. If you require a CT scan, this is $200. If a bone graft is required, the cost of this procedure is determined by the dentist, surgeon, or periodontist that is providing the treatment. Below this video, please find a list of frequently asked questions. If you have any questions not listed here, please ask Seth, Gabe, or Krystal. We look forward to making your dental implant experience as pleasant as possible. Once again, thank you for choosing SGK Dental Associates.